Good afternoon, everyone. So thank you for that great intro. I think I've doctored the whole county, and I found my people, and I love Miami-Dade County and the people. When we do this Black Health Summit, you see, we didn't talk a whole lot about blood pressure, diabetes, and all of that, because what we want you to understand fully is what makes people sick and what we're going to do that I can't do as a doctor. Doctoring, prescriptions, MRI, CT, surgery. I have done it for 37 years, and we still have bad stats because we have to understand fully what's making us sick. So I'm gonna do 10 minutes of that doctor stuff that everybody likes to sell, thinking that's what we're gonna have to do, get personal responsibility, eat right, exercise, and do this. We're giving it 10 minutes because that's really what's all we can do. I don't know if you can see it, but what do we know about Black people in America? There really aren't that many of us, only about 14% of the population. If you look at that little pyramid-looking thing, you see Black men and women about equal in numbers until you get to around 30, where the dying of Black men really accelerates. And so the 47 million then starts getting skewed over to Black women. And if you see where Black folks live, much more in New York, Northeast, Florida, really. Miami doesn't have as many, about 14%. The entire South Florida has about 24%. And so when we're looking to make actions, especially Miami-Dade County, you've got to find how we're going to align ourselves to be able to get that action. Political power cannot happen unless you're at least around 20%. So if you're under 20%, you've got to align your powers and figure out how are you going to sell them what they're buying, but you got to have the power of the people together in a line. You can see in the US, we're only 14%, and if you divide that up, 7%, that's not a whole lot of people that we're talking about, but it's a lot of dying. When you look at what we do, we are really improving in education. Black women above, but Black men are catching up. The Black population in the US is about 30, average age, the median age is around 30, 31, 32, around there. Dade County's a little bit older, about 35, the median. So you're not looking at a lot of very young people. Their median is 30, 35. But that does show that the younger folks coming up are getting educated. They're getting the skills to be able to come out into this world and survive better. I bring this other chart, which is so hard to see, is how many people are married. Why do I talk about marriage? When I talk about health, most of my patients for my 37 years once I left residency was all about women. There's so many more women in the health field come to see the doctor. And the only time I saw men was when the women brought them. And when you look at the marriage rate, it's only around 30-something% for Black folks. Black women a lot less, not a lot, a little bit less, but Black women, as Black men, as their incomes drop, there are more single Black men, which then means who's bringing them to the doctor, who's advocating for them. And so we have to look at, as a community, what are we going to do if the woman, who is the safety net for a whole lot of the health system in America right now when it comes to elderly care, child care, every care, if that man doesn't have a woman, how is he going to fare? You'll hear a lot of issues around gender and why we encourage people to understand gender, because that's telling you what your society is doing to the people who biologically came into this world one way. Then what does gender identity mean, and how does that impact your health? But I'll show you some sexual differences, the biological sex. You know, males have a Y chromosome. Does that really make them that different to the female? Yes, in certain ways, what they produce. The women have two X's. That also gives them more estrogen, different hormones that makes them produce differently so they can have babies, and the men creates different physiologic changes. The men will have more muscles, they'll have bigger bones, they'll be stronger, their brains are bigger, but it doesn't translate into more intelligence when you do the comparison. The women's hippocampus, which helps you to learn fast and memorize, that's why often you see girls will do well in a school system that encourages memorization, because they were just born with hippocampus that alerts you to learn and memorize better. But men have better spatial abilities because that's how the brain works. But when we say male and female, because when you look at gender, if the woman really had bigger brain and bigger, well, smaller regular brain, but bigger ability to memorize, who would be the CEOs of this world? It's males. So this is where gender matters and what happens in the environment matters, because physiologically, none of these differences that we see really change the outcomes in your overall success. The other factors that you learned about today is what drives it. When you get to the top 10 causes of death, really interesting, it's not very different for everybody. It is number 1, heart disease, and that's the entire US is heart disease. And then number 2 is cancer deaths. And that's always a problem. When you look, what we see for Florida, number 3 is unintentional injury. Now that's all the violent crimes that we see that's happening, and that goes back again to social determinants. That's nothing to do with X and XY. And when you see the other areas, homicide, these are for Black men. This is very different than when you see overall US. The US rates have a little bit more. For Blacks, Alzheimer's is higher, homicide goes up rather than unintentional. We have an opportunity to screen people early. This is like, I tell my patients who, I don't want a colonoscopy. I'm like, oh my God, colonoscopy, that's the one test where I can prevent the cancer. Mammograms, I find it early. PSAs, I find it early. Everything I find it early. The colonoscopy, I can go in and I cut it out before it gets to cancer. How could you say no to that? But it's our understanding. And knowing your family history is so important. Those are the top cancer killers there, and those are the things that we have to get folks out there. I have too many people who turn down their colon cancer screening. And that's just from ignorance, so spread the word. Any man you see, if he's 45, Black male, please tell him, go get screened. There's a higher rate of it. And it's probably from the environment, it's probably from all the toxins, because Black folks live around toxic environments, and that's probably what's driving these changes. Hey, how you doing, brother? Yeah, just great. You know, it's colon cancer screening month. Don't forget to get it. Spread the word, make the community to know that we can prevent these. Prostate cancer. Who just died from prostate? Unfortunately, O.J. Simpson, that's what he died from. And we're hearing so many prostate cancer issues. So you can screen it, we can follow it, we can get it before it kills you. And lung cancer, you got a smoker, they can be screened. It's a low-dose CT test, it's so easy. And we can get it early. Life expectancy, you saw all the data. Why I'm showing it is that between 2019, 2021 was COVID. COVID really, you saw, did kill a lot of people. But what's also on top of this is the substance use. And with the impact of fentanyl, especially in the Northeast and everywhere down that's coming in, is fentanyl and drug overdoses. It's being underreported in the Black community as a media issue. Everybody thinks it is just a white, middle America problem, but it isn't. It is killing a lot of Black men. So our decline in the death, in the life expectancy comes a lot from the substance use and the overdose from these drugs, in addition to COVID, but we cannot deny what's happening with fentanyl in the Black population. So we're going back, improving, because COVID deaths have declined, and we're seeing an improvement in life expectancy, but we're still not even in the 70s for Black men. So my patients, if I happen to have a Black male and they're like 60-something, they want to, should I take my Social Security early at 62? I'm like, you know, the data is not great. Somehow, I think you should, the minute you get to 62, take your Social Security. Because when you look, they're not making it to 70 and 75 and 80. Black women are going in the 70s, so I'm like, most of my patients have been so weathered that I'm like, take your benefits, and if you make it past there, it'll be great. But we pay a whole lot of Social Security to not collect, but we can make a difference. So please, there is so much hope. Miami-Dade County is an amazing place. South Florida is an amazing place, but we have got to understand what we're all about, which is the social determinants, the political determinants, policy, voting, understanding that maybe you may have to close your eyes and vote for the ticket that supports you and protect your gains, because we have lost, but we must protect our gains. Thank you.